Hello there. Welcome to our midterm review to my BS Criminology students, BS Crim 2A, 2B, and 2C. This is a pre-recorded video, so you guys will be prepared and ready for the upcoming midterm examination. So, as promised, I have created a review pre-recorded video so you will be reminded with the things that you have to focus on, and you have the scope as to what to focus. And of course, so you'll get perfect score if you would only listen and try to understand each discussion that I am about to share. So let's get started. So here is a picture of me as a Red Cross first aider. As you can see, this is one of the trainings that I had with my students way back in Noveleta, Cavite, with my SSG students. And in this picture here, this shows a real scenario. This is the one that I shared to you guys, where I responded to a motor vehicle accident, but sad to say, she wasn't able to make it. Now, let us proceed to our review. Now, let's first have this objective and purpose of first aid. So, what's the objective of first aid? Of course, this is to prolong the life of an individual. Yeah. And the purpose is, of course, to preserve life, to prevent worse condition, and to promote recovery. So may it be a simple accident or like minor, rather, minor accident or a major accident, first aid is really necessary in order for you to respond to the needs of the victim or to the one that is involved in a particular accident. Okay. Now, what is BLS in first aid? Well, BLS stands for Basic Life Support. Well, that is very self-explanatory. Basic, meaning to say these things that we will be doing, or the things that is doable, feasible for a first aider to do, without any advanced treatment from the medical team, and it supports life, of course, of an individual. So that's why it's called BLS, or we call it basic life support. Okay. And for first aid, of course, this is an initial assistance to person or persons who are injured. So that is the question. Who is the most important person in an emergency situation? Well, if you could still remember our discussion during our face-to-face class, you are actually the most important person in an emergency situation. Always, always put yourself first in the scenario. Okay. Again, you cannot give what you do not have. If you don't have any more the life from yourself, we will not be expecting you to be efficient or effective if you yourself is injured already because you did not, you compromise your safety, right, when saving someone. So, again, who's the most important person? The answer is you. You are the most important person in an emergency situation. Okay, now let us proceed to the responsibilities when responding to an emergency situation. So, first is you have to assess the situation quickly and calmly. Okay, so it's highlighted here quickly and calmly. Of course, every second counts. And as a first aider, one of the traits that you should possess is you have to stay calm when you assess the situation in order for you to have the right thinking, the logical thinking as to what is going to do first, what you are about to apply as a first aider, And of course, so for you to do the primary and the secondary assessment, you have to stay calm. Okay? Next is arrange for appropriate help. This is where the bystanders are very useful. You tell them what to do, what are the information needed in order for them to call for assistance or help from the emergency medical team or the EMT. And lastly is perform the primary and secondary survey. So this is what I have mentioned earlier, primary and the secondary survey, which we already have tackled that one during our discussion. The ABC, which I will be tackling that one later on as we go along with the slides, and the secondary survey as well. Okay? Now, these are the things that we have to remember. When interviewing a responsive victim or the casualty, the most important thing to remember as a first aider is you have to stay calm. What do you mean by that? You should not be the first one to panic. Imagine there's already a victim or a casualty. She can already see her wound, her open wound, and you are panicking, you're shouting. So what do you expect from the people who's watching you or the victim himself or herself? They will not be trusting you as the first aider because they will be thinking like you might collapse or you don't have the capacity or the capability to respond, right? So first thing first, even if you are so nervous, even if you feel like fainting already because you can't bear seeing the blood, you have to really stay calm. Okay? Next, why should you wear personal protective equipment? Very important, of course. That is to protect yourself from blood-borne diseases. Always remember, you are the most important person in an emergency situation. So you should protect yourself from any harm. Like, not only the gloves, but also the mask, right? So any diseases that you can acquire, it will absolutely give you a very harmful effect as a first aider. So you really have to, be safe, and you have to observe wearing personal protective equipment if necessary. Okay. Next, we have psychological support. Why is this very important? Well, of course, this is to assure the victim that everything is all right and that the help is on its way already. So you really have to give that psychological support for the victim to fight for his or her life because you're giving him or her hope that everything will be all right. Okay? Next, we have this is a typo error that's first aid. Well, this is everybody's responsibility, not only those who are trained, but of course all people around the situation. It is our responsibility, and you have to be ready to give emergency care and can make the critical difference in saving a life, relieving pain, and preventing further injury or infection. And that is the reason why this is embedded in your curriculum. As a future policeman or as a future authority in the society, you have to be trained how to do first aid, right? So it's everybody's responsibility. Okay. Now, when contacting the emergency medical system or support, rather, you must give the callback mobile number first. Okay, always remember the first thing that you have to give them is the callback mobile number. Why? Because the call might get disconnected, and don't expect that they have this caller ID all the time. What if they don't have that? Right? So at least they can call you back. Okay? So that is very, very necessary. Okay? Now, let us proceed to this one. Which sequence must be observed when you see a vehicular accident at the middle of a highway? So first is you have to survey the scene. Is the scene safe? As a first aider, you have to secure yourself first, right? Second is you have to do a primary survey of the victim. So Here's what we call ABC. I will discuss that one later on. Okay. So next one is you have to give a phone call to the emergency medical services to ask for help. Very, very necessary that you have to utilize the people that surrounds you. Those people who are taking videos, pictures, you can actually ask help from the bystanders. That's their role, right? Ask assistance, ask help from them to call the CDR or MO, or call anyone that they know, like Red Cross, who can respond right away. Okay. And lastly, do a secondary survey of the victim. Very important that you have to survey more if there is like added injury, or if the victim is still conscious, and you have to keep him or her awake, most especially if you cannot see any blood, and it is like a vehicular accident. Very, very important that you have to keep talking to the victim and tell the victim not to fall asleep, because there's really a high chance or high tendency that if the victim will fall asleep, he or she might not be awakened anymore. Like, very important that you have to tell him or her to really fight, that dizziness, or if he or she feels that. So your role as a first aider is really very critical. Okay. Now, for the primary survey, here are the things that you have to keep in mind. First thing that you should check when doing primary assessment is, again and again, I keep on highlighting this, check whether there are risks for yourself. Okay, so you should really double check, triple check if the place is safe for you to respond. Okay. Now, next is when applying the primary survey, below must be performed first. You have to perform first the ABC, okay? That is for life support. A stands for airway, B stands for breathing, and the C for circulation. Okay. Now there are two systems in our body that is really critical when performing a primary survey, and I am pertaining to respiratory and circulatory system. So that's the lungs and the blood circulation. You have to check it out because these are the critical part of our bodies that should work, so that a person can survive. Okay. Now let's talk more about ABC for the life support. For airway, what should you check is the possible obstruction. Okay, make sure that the mouth or the airway is free from any obstruction. May it be a liquid, a solid, or anything that obstructs the mouth and the nose. You have to remove that one, and you can use your pinky finger to do that. And you have to be very, very careful and gentle. Next is breathing. Use the technique of look, listen, and feel. So how do you do that? You kneel down, as I have taught you the last time. You have to use your chin, and you have to look at the tummy, the rise and fall of the breathing of a person, and also the you have to listen if there's like pulse of the person, and feel if the person is still breathing or still conscious, right? So life support is really necessary in this part, and just by doing the look, listen, and feel, this will absolutely help you identify if the person is still conscious or not. Okay. Next is circulation. You have to check the pulse of the person. You can check it here or here. Okay. And the nails. You can also check the nails of the person if it will turn back to its original reddish color, then the circulation is still in good shape. Okay, so again, that is ABC, airway, breathing, and circulation. Okay, now let's proceed to secondary survey. Here are the things that you have to keep in mind. When you interview the victim, you should always stay calm. Okay, and you have to get all the necessary information that we need, like for example the name of the victim, the address, the last thing that he or she remembers before the accident, and this are the things that you will also be giving to the medical team when the rescue arrives. And next is check if the victim is breathing, has pulse, if body temperature is normal. So these are the things that you have to do in secondary survey. And you have to check as well for any other injuries from head to toe. So you have to be very observant and very particular with how the person or the victim is feeling. So you can ask him or her, how do you feel? You can even ask him or her to rate, if he is having like um, uh, dizziness, you can ask the person if he can still hear you or see you. So very important that when you interview, you are very detailed with your questions, very specific, and jot it down if you have a pen and a paper, because that will absolutely be a great help. Okay. Now, let's talk about CPR. CPR, or this stands for cardiopulmonary. Sorry, this is typo error. That is cardiopulmonary resuscitation. Okay, so during a cardiac arrest, the heart cannot pump blood to the rest of the body, so including the brain and lungs. That can happen in minutes without treatment. CPR uses chest compressions to mimic how the heart pumps. So the heart can no longer do it, so that is why we do compressions. We call it chest compressions. So these compressions help keep blood flowing throughout the body, and that is why we perform CPR. So when can we perform CPR? CPR can be done if the victim is unconscious, has no pulse, and not breathing. Okay, so again, that's unconscious, has no pulse, and not breathing. So you don't perform CPR for unconscious person, but if you see the person is still breathing, so you don't need to do CPR. You cannot also perform CPR to those person or victim who has open wound, where you have to apply the chest compression, because it will just worsen the scenario. Okay, the blood is already there, so when you pump it, when you do the compression, it will only lead to critical situation. And conscious but very pale, so still conscious, right? So the person is still conscious, so you don't need to CPR if the person is conscious. Okay. So let's proceed here. When should you place someone to recovery position? So you place a person to recovery position when you already have seen that the person is already breathing. Okay, so even if he or she is unresponsive, but you can see that the person is already breathing, then put that someone to a recovery position. So, what are the advantages when we perform first aid, or if we have knowledge about first aid? Of course, safer community. Again, we are all responsible to learn first aid, right? As part of the community. Saving lives, of course, your own life, or even the person close to you. And the third one is increasing your confidence. As a responder, as an ordinary citizen, at least if there's something happen and you are trained with first aid, you already have the basic knowledge, and you are now confident enough to perform the things needed in order for you to respond to a particular situation. Okay? Now, here are some medical conditions that we have to keep in mind. Shock, it's actually when a person is confused, has very pale skin, and loses a lot of blood. Usually, it happens like electric shock. Or even you as a person, if you are not feeling good, you're nervous, or you have heard the bad news, a person will be shocked. That these are actually the things that you can observe to a victim. Okay. Now, bleeding, the loss of blood. So it can be external or internal. It may be a cause of laceration or if it's internal, very critical because you cannot see that one in your naked eye. So you really have to be very vigilant to that, because most of the people actually died because of the internal problems, right? So that's why earlier I mentioned that you have to keep on talking to the victim if he or she is conscious, because if there's like internal hemorrhage, at least you keep the person awake. So, how do you stop major bleeding effectively? You have to use direct pressure. So, very important. We will be doing that one in like few weeks from now, and you will be doing hands-on with the materials available. So, don't worry, we will be performing all that. Okay. Next, here's guidelines for preventing cross infection. So, uh, cover cuts and grazes on your hands with waterproof dressings. Try not to breathe, cough, or sneeze over a wound while you are treating the casualty. So most especially right now, though we are still in COVID-19, right? So please avoid coughing or sneezing towards the victim. And then if gloves are unavailable, well, you have to be very resourceful. You can enclose your hands in clean plastic bags, right? Just to avoid any infection, most especially if you have one, and then you might accidentally prickle your hand, and that might actually cause like any critical diseases that you might acquire from that person. So very important that you protect yourself. Okay. Now, here are the traits of an effective first aider. So, ask yourself now, do you have these five basic traits? Because if you don't, then that's a very big question mark if you can be a first aider. So, first is observant. Sorry, another typo error again. That is first, safety first. So, you have to be very observant, right? Observe first before you take action. Okay, safety first. Second, you have to stay calm. Of course, this is to gain the trust and confidence of the people around you, most especially the victim. He or she needs psychological support. So, if you are not calm, then how can you expect to give that kind of support to the victim, right? So, again, stay calm. Next is resourcefulness or being resourceful. Very important because again, nobody knows when an accident could happen or where the accident would happen. So, as a first aider, you have to be resourceful with the available materials in place in order for you to make use of the available, like if you don't have bandage and you can see like clean cloth there, then you can actually maximize that. You don't really have to go to the nearest hospital or to the nearest store just for to buy, and all those stuff should be available. All you just need to have is a presence of mind. That's why you have to stay calm in order for you to be resourceful enough to look for ways and how you can respond even without those materials available. Okay. And this one, very important, tactful. Why do you have to be tactful? Of course, you have to be very careful with how you position your statements when you call the emergency persons. Written in the identification card, you don't shout at them, and you don't just tell them right away that hey, there's a motor vehicle and your wife or your husband is not in good condition. What if the person you're calling has like heart problem, right? So you have to be very tactful. You have to position it in a way that the person uh, who accept the call will be able to understand the situation, and of course prepare that person to accept or to receive the bad news in a manner that you are still professional when you talk to them, and that you really have to make them feel that you care, and that you are there. Assure them that you are there, and you are doing everything as much as possible for you to help the victim. So again, tactfulness is very important. Yeah, and you just give what is necessary. You don't be marites or what. You don't over or exaggerate the story. You have to be very careful with your statements. Okay. Now, lastly, is be gentle. Okay. Don't add on the hurt. So the person is already hurt. Please be extra careful when you apply the first aid, right? For example, you are now applying the bandage to an open wound. You have to be very gentle, and you have to ask the person, is this okay? Is this tight enough? Are you hurt, or how are you feeling? Are you comfortable? Something like that. Okay. So again, a recap. Traits of an effective first aider: we have observant, calm, resourceful, tactful, and gentle. There are a lot, but these are actually the top five that I could think of for you to be an effective first aider. And I believe that's it. So thank you. Thank you so much for listening. If you have questions, just please have that question added in our Google link form that I'll be sending in a bit. And you have to screenshot as well yourself watching this video from the beginning to end. So one screenshot for the beginning and the end of the video that you really have watched the entire video, and also your insights after watching this. Okay, I assure you that if you listened and tried to capture every detail that I was mentioning earlier, you'll be able to get a perfect score during your midterm exam, because these are actually the things that will come out during the examination. So the exam is multiple choice and there is also situational. So you really have to understand, read and understand before you answer. Okay, so good luck, guys. And I am very excited to see the result of your midterm. So you can do it. Thank you so much for listening. Again, this is your teacher, MJ. Have a beautiful day ahead.